registered physiotherapist and owner of Home Comfort Physiotherapy. Today, I'd like to talk a little bit about the condition called frozen shoulder. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially, frozen shoulder, essentially what this is, it's another term for it is called adhesive capsulitis. And essentially what happens here is when the anterior capsule of the shoulder, there's three actually specific phases that take place here. Number one, there's an inflammatory or pain phase. And this is essentially where a patient will start noticing some significant pain in through the shoulder. It's a constant pain, can potentially be worse at night, but it's a situation in which there might be a trauma involved in it, or it could be something that more or less comes out of the blue. And so the patient again notices this sort of consistent pain that just won't seem to go away. So that's kind of phase one, right, of this. And the treatment typically when a patient is in this sort of phase, it's usually just, they do recommend a cortisone shot at this point. So again, this inflammatory component of it. The second phase in this condition is called a freezing phase, and this is essentially where the patient will notice some restrictions taking place in through the shoulder, right? So at first there's this significant pain. The second component is, hey, I'm starting to lose some of the mobility in through my shoulder, particularly external rotation, which is essentially this movement right here, where we're bringing the arm out to the side. That becomes very restricted, right? So external rotation, you'll also see a restriction with hand behind back, and then also with flexion, but usually the most pronounced, right, is going to be your external rotation. And I think perhaps part of the reason for that is the fact that it's typically the anterior capsule of the shoulder that becomes significantly inflamed. And then finally you have a thawing phase, and this is where patients will start to regain some of the mobility in through the shoulder. So again, we have these three separate phases here. And from a physiotherapy standpoint, what we want to try and do around that sort of freezing and thawing phase is trying to maintain and gain as much mobility in through the shoulder as possible. Now, with having said that, there is a general rule, essentially, that we want to stay in this sort of middle ground area in terms of our mobility. We don't want to be too aggressive because unfortunately that can then restart this inflammatory sequence, right? So typically we want to, when we're doing, let's say, mobility type work, right? And in a lot of the cases, the exercises involved are going to be active assisted, which essentially means using the other arm, right, to help move the affected side. We really don't want to push and be aggressive into pain. So once somebody reaches that discomfort level, we back off. Once we go into pain, we back off. And as I mentioned, the typical exercise protocol for this is going to be a lot of active assisted passive mobility, where the physiotherapist will do the movement for the patient, again, not being aggressive with it, but going to the point of discomfort, backing off. And then the exercises involved are typically going to be passive or active assisted exercises, things like pendulums, right, where a patient might be using their body to swing the arm, pulley system, shoulder pulley system, where there's a pulley set up on a door frame, for example, and then active assisted using maybe a stick or the other arm to try to, again, maintain and gain as much mobility as possible. Now, unfortunately, with this condition, it can take some time to go through all those three phases. Can take up to a year, 18 months. But it does vary with individuals in terms of that sequence. But it can be quite debilitating, and it can be quite a long process in terms of getting back to function and mobility through that thawing phase that I talked about. If you have any questions or concerns, feel free to leave a comment below. And if you or anyone you know could benefit from some in-home physiotherapy, perhaps you might be struggling with some frozen shoulder yourself, feel free to reach out. I do have links below. And please check with a doctor or physiotherapist to make sure that this or any other information is appropriate for you. Thanks again and have a great day. Take care.